Walsh is speaking right now on the coronavirus.
16,770. 12 new deaths, bringing the total to deaths in Massachusetts to 8,729. Boston's numbers, we did not get today's numbers yet, so I only have as of yesterday. 31 new cases, a total of 15,263 cases in Boston, and there were 4 new deaths yesterday, bringing the total to 752. And as always, our prayers go out to those that are sick and suffering from COVID-19, and the families who've lost loved ones. Want you know that you're in our thoughts and prayers. For the week ending August 22nd, the 7-day average positive test rate was 2.3%, which is down from 2.7%, so we saw a nice little decrease there. The cumulative positive rate since the beginning of the pandemic is down to about 10%. At one point, if you remember, we were at about 38% here in Boston. Emergency room visits for COVID symptoms remain very low. The number of COVID patients in ICUs remain very low as well in the city. The average daily new cases in Boston remains around 40. So if you take the numbers and you add them up, it's about 40. Higher new case numbers in recent weeks are due to, in part, significant increasing in testing that we've been doing. Last week, the number of tests in Boston went up again, so we've had, I believe, 4 consecutive weeks now of additional tests. The average test last week every day was 2,028 tests, people tested per day in Boston. That's a 10% increase and more than double what we're doing earlier this summer. So we are testing many, many more people. Citywide, we have more than 20 testing sites, including mobile sites, that are moving in areas with the greatest needs. Many of the sites, testing is available to you at no cost. Our free mobile site is at Jubilee Christian Church in Mattapan today and through Saturday. It's free and open to anyone, regardless of your symptoms. You can also get a full map of testing locations. Go to boston.gov/coronavirus. That's boston.gov/coronavirus. We're going to keep working to provide more and more testing, guidance and information and support. And we need everyone to keep doing your part as well as we move forward here. I just want to remind everyone again about the need to constantly wash your hands with soap and warm water. Avoid large gatherings. Stay 6 feet away from other people. Wear a mask when you're around people, when you're going for a walk. If you operate a business, follow the guidelines and make sure your employees and customers can follow them as well. So take time to explain to your employees and customers the guidelines. And we need to continue to remain very diligent here. As you saw the last 7 days, we've seen a decrease in positive testing. That's a good thing. We want to continue that decrease as we move forward into the next phase of the summer and then into the fall. Neighborhood disparities and targeted responses that we're working on. We continue to monitor and share neighborhood data and race and ethnicity data as we have throughout the pandemic, so that's all online and you can get that information. Anytime we see testing numbers go down or cases increase from particular communities, we target responses to address the needs in those different areas or neighborhoods. There has been ongoing work of our COVID-19 Health and Equities Task Force, especially around racial inequities. It's been the focus of our outreach partnership, including with the Greater Boston Latino Network, with support from the Boston Resiliency Funds. We have worked together to bring COVID numbers down all across our city, and last week, every neighborhood except one tested below 3.5% positive rate. East Boston is one neighborhood where positive test rates have been higher. It's been coming down, but last week we took another turn upward to 11.4%. It's a concern and something that we're addressing. We're examining many different things. We're examining the data and the contact tracing to see where these new cases are emerging and coming from, who's impacted, and how to best intervene in those situations. We are moving our mobile testing team to East Boston starting on Tuesday, September 1st. The East Boston Neighborhood Health Center, I want to first of all thank them for the work that they're doing. They've already have a very active testing site, but it will help create another access point for residents of East Boston. Well, quite honestly, anyone can take the test there, but trying to get more tests into East Boston. We are talking with the state about finding temporary isolation housing so that people can quarantine away from their families if they test positive. Yesterday, I had a meeting with City Councilor Eddie Edwards, Senator Joe Boncory, and Adrian Martero, the state representative in East Boston. We're working to make sure we continue to get messaging out to the community. We launched an action plan to work with the community. We're mobilizing teams to provide safety materials and educate residents and businesses, using the languages spoken in the neighborhoods, including English, Spanish, and Arabic, at MBTA stations and key intersections in East Boston, including Maverick Square, Orient Heights, Wood Island, the airport, and Central Square. We're expanding into neighborhood parks at these times, people gathering, playing soccer. We're asking people again to follow the guidelines that have been laid out by the City of Boston, by the Parks Department. We're distributing care kits and talking with residents and constantly letting residents know what's happening. Those kits that we're giving out include hand sanitizer, masks, testing information, and COVID information. We are sharing information on the importance of social distancing, of face covering, hand hygiene, and avoiding gatherings. We're answering questions that people might have about COVID-19. We're explaining how to practice safety in the home where somebody has symptoms or has tested positive. We're making it clear that anyone can and should get tested, regardless of your immigration status. No information about your status will be asked when you go for testing. Making clear that residents can file confidential complaints with the Boston Public Health Commission if employers or businesses aren't following safety guidelines. We're also working with businesses to help them follow the guidelines. Business outreach started today in multiple languages. We're making sure management and staff know the regulations and have the access to PPE and prevention efforts like social distancing and hygiene. Distributing COVID checklists, fact sheets, and signs, including posters that demonstrate the importance of wearing face coverings. Reminding employers that they need to report to the Boston Public Health Commission when they have an employee that tests positive. We are looking at tightening up regulations around gatherings in public spaces, but hope that it doesn't come to that. This is an all-hands-on-deck effort, and we're working together, all of us, including all the electeds. In the city, cross-departmental teams in the City of Boston, including the Boston Public Health Commission, the Office of Neighborhood Services, the Office of Small Businesses, Inspectional Services, Boston Transportation Department, Emergency Management, Police, Fire, EMS, medical and social service providers in the community, union leaders who represent people working and living in the neighborhood in East Boston, church officials and clergy who have helped get the message out at Mass and other services over the weekend. We need to make sure we're taking this really seriously because of the number being so high. We're going to do whatever it takes to get the message to people that COVID-19 is still with us and all the precautions that we've been taking are still very much necessary. We're going to continue to work together on new strategies and solutions, and we need residents. We need the residents to spread the word and work with us. We also know the economic conditions impact the COVID numbers. Multi-generational housing, families living in housing, mother, father, child, grandparents. Higher rate of overcrowded in housing. People who have to work outside of the home coming back into the home. We're bringing resources to those families, supporting them when workers need to stay home is a big part of our solution. Food access is another area that we've done a lot of work on the last 5 months. We've had a major effort in the spring working with many partners to serve over 2 million meals in the City of Boston since the COVID crisis started. We adapted and kept it going over the summer through the Boston Public Schools and the Boston Center for Youth and Families and all of our partners. We are planning to maintain food access over the fall and the winter. The USDA did extend the meal site waiver to September 18th so we can keep feeding young people safely, and we're asking them again to extend it beyond September 18th through the end of the year. I'm joining other cities to ask them to extend it to support remote and hybrid learning plans. So what that does, it helps us, it allows us the opportunity to be able to deliver meals if our kids are not in school. Our school plan that we announced last week, the latest start date, or the last group of kids to go in, will be November, I think it's November 17th for high schoolers. So that means there's a lot of meals throughout the fall and early winter that we'll be still delivering to homes. We need Congress and the White House to bring more relief to Americans hit hard by this pandemic. But we're not waiting for help here in Boston. We're using all the resources and all the partnerships that we have to make sure that hungry residents in the City of Boston have food. One vital access point is the Boston Housing Authority. They house over 58,000 residents, including 9%, which is 9% of the Boston population. Today, I can announce a partnership between the Boston Housing Authority and local businesses and nonprofits to get hundreds of thousands of meals to vulnerable residents throughout the end of the year. This plan leverages $2.5 million in federal aid still available to the CARES Act. It will provide up to 230,000 meals to around 4,100 low-income households throughout the month of December. Nearly $1.7 million will support the Boston Housing Authority's family meal sites in partnership with City Fresh Food, Commonwealth Kitchen, Haley House, and the YMCA. City Fresh Food is a business of color based in Roxbury that hires employees from the community. Commonwealth Kitchen is a women-led nonprofit incubator that serves many areas of color and women-owned businesses. Haley House is a nonprofit in Roxbury that employs people who face barriers to other jobs. The YMCA of Greater Boston has been one of the key partners in food distribution since the beginning of the pandemic, and actually, quite honestly, long before that. We're going to use over $730,000 for door-to-door meal delivery to seniors facing food insecurity. Our partners in that work is Ethos, a nonprofit in Jamaica Plain that helps over 3,000 seniors and people with disabilities stay in their home. They operate the Meals on Wheels program, as well as many meal sites in partnership with our Age Strong Commission here in the city. Since March, they've expanded and adapted their operational dynamic dramatically. Meal sites have been safe to more seniors, and people with disabilities could stay at home. Many volunteers and caregivers are also in high-risk categories, and that's another challenge that we have. Back then, we helped Ethos with $559,000 from the Resiliency Fund to include over 850 caregivers in their service. That means they're helping not just the clients, but also the caregivers who need support. Many of the caregivers that work in these industries are low-income families, and they need help as well. In addition to the partnership with the Boston Housing Authority, we're providing another $500,000 from the Resiliency Fund so they can continue their work as well. This grant will help fulfill the daily needs as the pandemic continues. It will also make sure that it is a trusted person each day to check in, reduce isolation, and connect seniors to services and support. Seniors need to see consistency, and having the same person is extremely helpful. I'd like to thank Ethos for their partners and all the partners that work with Ethos, the Boston Housing Authority, our Age Strong Commission, our Office of Food Access, for all the great work that they have done. The Boston Resiliency Fund has distributed over $25 million from the day we started collecting money to provide COVID testing and other life-saving services during this pandemic. Over $14 million of those funds have provided food access and other basic needs in vulnerable households all across our city. Today, I can also announce two other new initiatives from the Boston Public Library to help bridge the digital divide in the city of Boston. This is a vital equity issue, and it's one that's more clear during the era of COVID-19. We do this work on a number of fronts. We created an Office of Broadband and Digital Equity to be a leader in this work. Our digital equity fund, provides grants to community organizations that expand access to technology and the internet. Our Wicked Free Wi-Fi system brings free internet access to over 100 points across the city in all of our Main Street districts. Digital access is also central to Boston Public Schools' plan for remote learning. We are currently taking steps to understand the technology needs for seniors in our public housing residents. The Boston Public Library has been a long leader in free access to technology, and they are leading again in this crisis. This week, the Boston Public Library launched an outdoor Wi-Fi program. It provides internet access 24 hours a day in the public spaces around 9 Boston Public Library branches. It allows users to socially distance while using internet for free. The locations were chosen based on data reflecting at-home broadband access, household incomes, and the availability of outdoor seating. The branches are Mattapan, High Park, East Boston, South End, Common Square in Dorchester, Parker Hill and Mission Hill, Grove Hall in Dorchester, Roxbury, Eggleston Square in Roxbury, Jamaica Plain, and the Honan branch in Alston. The other new Boston Public Library program is Public Computer Access. BPL buildings remain closed for indoor use, but now you can sign up to use a computer in a socially distanced space within the Central Library at Copley Square. You can book 2-hour slots Monday through Thursday. You can go to app.bpl.org/computers or just call 617-536-5400. As a reminder, digital borrowing of online items was expanded at the start of the pandemic and remains extremely popular here in the city. And BPL To Go allows you to reserve and pick up physical books and other items at every branch citywide, except for those branches that are under renovation. For more information on Boston Public Libraries, you can go to bpl.org. Voting information: the state primary election is a week from today, Tuesday, September 1st. Early voting is underway currently in the city of Boston and runs through Friday. You can vote here at City Hall Monday through Friday from 9 to 5. Tomorrow you can get to vote at 4 other locations in our neighborhoods: the BCYF Perkins Community Center in Dorchester, Mildred Ave Middle School in Mattapan, St. Nicholas, excuse me if I apologize, Orthodox Church in Rosendale, and the Margarita Munez Academy in Jamaica Plain. All voting locations are using existing safety cleaning protocol and are accessible to voters with disabilities. We're asking you, when you go to vote, make sure you're wearing a mask. We're also making sure that voting by mail is an option. It's a safe way to exercise your vote. Today, August 26th, is the deadline for requesting a vote by mail ballot. If you happen to be listening to this and you want one, you can drop your application off here at City Hall at our box right inside the door there where you vote, just to get a mail-in ballot. We've received about 90,000 requests and we're processing those requests as they arrive daily. These are for mail-in ballots, 90,000. I encourage anyone who has a mail-in ballot to complete it and return it as soon as possible. You can either mail it or you can drop it off. You can hand deliver it to an early vote location, or there's 2 drop boxes here at City Hall. Inside the main 3rd floor entrance behind me, Monday through Friday, 9 to 5, or outside on the 2nd floor entrance on Congress Street until 5 p.m. Tomorrow, from 9 a.m. to 5 p.m., you can do that, and then on Friday, 9 to 5 again. If you are at City Hall, you can also simply cast your vote by early voting. So far, of the 90,000 ballots, we've received 24,600 completed ballots, 6,000 from early voting in person, and over 18,500 in mail. We're going to do whatever it takes to make sure that we count that every vote counts that's cast. But it would help a great deal to have a timeline that supports the special situation that we face this year. On, I believe it was Monday or Tuesday, there was an argument in front of the Supreme Court. And I support the argument that was argued in front of the Supreme Court to require the counting of mail-in votes postmarked by Election Day, not just received by Election Day, and the 10-day extension to make sure there's time to count those votes. This is our democracy, and we should all be making an effort to ensure that everyone's vote is counted. What we saw at the post office a few weeks ago, we're not sure what's going to happen, or I'm certainly not sure what's going to happen in November, and really having that ability about postmarking is so important. If you're looking for information on elections, we're asking you to go to boston.gov/elections or call 311 to learn more and get the information that you need. Just a final word on the psychological impact of COVID. I want us all to remember what people are going through. Illness in themselves or with their loved ones, fear of COVID. Many people have anxiety or anxious around this. People have financial stress, lost income, struggling small businesses. People fear of losing their homes, and the toll of systemic racism. Many experience it personally and also continue to see the footage of violence against black and brown people on social media. All of this together is taking a tremendous toll on a lot of people. It's showing up in mental health concerns, physical health concerns, playing a role in domestic violence and street violence, people struggling with substance use and recovery. For the folks in the recovery community or folks that want to get into the recovery community, meetings are happening online, and some meetings are happening in person outdoors. What I'd ask you to do is you can reach out to our Office of Recovery Services or to a recovery organization about meetings. You can call 311 to get information, or you can call Alcoholics Anonymous or Narcotics Anonymous to get information on that. We're asking people to take it a day at a time and continue to look out for your own health and your family's health. I would ask everyone to remember that these are not normal times. The tendencies for conflict will not serve us well in every single situation right now. I ask everyone to work together in a spirit of unity. I urge everyone to be kind to yourself and to others. I ask everyone to take it a day at a time. I have one question that was submitted prior to the press conference, and I'll open up to the press that's here. It's from Alan Miller at WHDH. With college students coming back to Boston, what is your message to them? Well, I first want to remind all of them how far we've come in our fight against the coronavirus as a result of our vigilance of the neighbors in here in the city of Boston. Students have always been a valued member of our communities here in Boston. It's important that we collectively as a city continue to work hard, not let our guard down, because we still have a long way to go in our recovery. I ask all students, particularly coming from out of states that the numbers are high, to familiarize yourself with our guidance. Follow the guidance laid out by your college, and make every effort to keep yourself and your community safe. And that also does go for the students living off campus. We're asking you to stay connected to your schools to make sure you understand how we move forward. We have been successful in our city over the last several months in keeping our number down, and obviously we dropped a little bit this week, but we still have a lot more work to do.